Hi, Dave Chotner here from Coastal Dental Arts. Today I want to talk a little bit about how we do our treatment planning. I use a three-pronged approach to treatment planning all patients. The first thing that we address has to do with person's periodontal health. In this image right here, you can see a patient has a fixed wire retainer, probably after having braces as a teenager. And what you see is a lot of this plaque and tartar built up around the perimeter of the gum line. This causes a lot of inflammation and can be very detrimental to the long-term health of the gums. So this is one of the things that we look at when we're trying to help someone's periodontal condition. We might recommend removing this or giving them some oral hygiene instructions. The second thing we approach has to do with a person's restorative needs. And this really is anything that I have to do to build a tooth back to the right form or function. In this example, the person's missing some teeth in the front. So it could be that we're going to be planning some dental implants. It could be a removable prosthetic. If we're talking about back teeth, if you have a cavity, a broken tooth, it might just be a filling or a crown. It's a good example. And the third thing that we address has to do with occlusion. And occlusion is a fancy word for the way that your teeth fit together. You either have a good occlusion or you have a bad occlusion or a malocclusion. In this case, this is an example of a malocclusion. There are a variety of types of malocclusions. This one, for simplicity, I would say we call it crowding. Crowding is visible by the fact that this tooth is sort of out of whack a little bit, same thing over here. And if we looked at this in a different view, you would see that the person has some substantial amounts of crowding on their lower teeth as well. And also their bite's not great. And when your bite's not great, this can create a whole myriad of problems. Teeth being worn and chipped, it can cause notching at the gum lines, and it can relate to some restorative needs if your teeth break. And in many instances, when the teeth become very crowded, it can also cause people to collect plaque around the gums, and then they can become needing for periodontal treatment. So taking a three-tiered approach is a great way to do ideal dentistry, comprehensive treatment plan, not missing anything, giving people an ethical plan to get their oral health tip-top. If you have any other questions, you can visit our website at coastaldentalarts.com. And we look forward to hearing your questions.